Over the last few months, I've realised how much I've been carrying around without really processing it. For a long time, I became so used to just getting on with things that I didn't stop to recognise just how much years of trauma had affected me. Being able to finally talk through everything instead of keeping it bottled up has felt like such a relief. It's helped me understand myself better, notice patterns I hadn't recognised before, and given me the tools to respond differently. I've realised that when I'm struggling, I tend to overthink, shut myself away, or throw myself into work as a distraction. Becoming more aware of those patterns has helped me respond to them in a much healthier way, and that's something I'm really grateful for. If therapy is something you've been thinking about, BetterHelp, the paid partner of today's video, makes starting therapy easy. You can take a short quiz and be matched with a credentialed therapist, and if you feel they aren't the right fit for you, you can switch at any time at no extra cost. You can communicate in whatever way is most comfortable for you, whether that's by phone, video or text. More than 6 million people have gotten help through BetterHelp, earning a 4.8 out of 5 rating on the App Store. Click the link in the description or visit betterhelp.com/bebravebeyou to get 10% off your first month of therapy. Hello.
Hello.
How are you?
I'm good, thank you. How are you?
I'm good, thanks. Hello, I hope you're well. So this is your patient for today.
Okay.
Alright, so we're going to be carrying out a general checkup, but today the patient is claiming she suffers with migraines and neck pain and upper spine pain around the shoulders. Okay, so if you could carry out some checks that, help investigate that out, as well as obviously your general checks. Okay, wonderful. What I will be doing is assessing, obviously, and if I need to step in at any point, I will.
Okay, so first of all, I'm just going to check your temperature,
I'll write that down for you. That's perfect.
Thank you. Had any trouble with your vision along with these problems? No. Alright, well, I'll check your eyes anyway, if that's okay. So if you look that way for me, please. And this way. I'm just going to cover this eye. Can you follow my finger? Okay, good reactions there. Perfect. Can you nod when you can't see my finger anymore? Thank you. Lovely. Okay, so that's really good. Doesn't look like you've got any blind spots.
Okay, what I would suggest as well, if you could get the pen light and just do some checks on her pupils.
Okay.
Okay.
Just look at my nose. Reacting well. Don't look at the light, just look at my nose.
Good job.
Okay, now if you can follow the light for me.
I like that addition.
Stay focused on the light. Perfect. Good.
That looks wonderful.
Can you tell me when my fingers move? Perfect. Lovely. Okay, so eyes look fine. I am just going to check to see if you have any sinus issues around there. Let me know if you feel any pain at all, okay?
Does that feel alright?
think.
Okay, good.
And was that okay for you? No pain?
We can maybe just check down here a little bit and around the jawline. Yeah, especially there. Does that feel alright?
That hurt.
Sometimes if we grind our teeth, clench, we can get migraines that way.
Can you open your mouth, please? And close. Perfect. No clicking.
So the masseter muscles don't feel hard or swollen. Okay, lovely.
Any sensitivity around your pupils? Temples?
Okay, so you feel like the sinuses are fine?
Yep.
Wonderful.
Yeah, no swelling or anything.
If we could maybe just feel over her scalp, just to see if there's any obvious lumps or bumps or anything that doesn't feel quite right.
Have you had a head injury recently?
Okay, that's good.
Any pain here? Okay. No, can't feel anything. That's good.
And also if you could ask the patient where she's been experiencing her headache.
Okay, so if you could point to me where the pain has been when you get a headache. So on the front and across the back, right there. I was touching here. Yeah. Can you feel any pressure there when I touch it? Right now.
Any pain or discomfort? So with your headaches, if they're quite here, that could be sinus related, even though it doesn't feel swollen. Could be a bit of tension headaches or something with your eyes. Maybe going to the opticians to see if there's anything wrong there. Would be
get your eyes tested.
I think that's a good referral point to say. But if you are experiencing problems with your neck, that could be causing the headache. So.
Are you on screens a lot, playing games, and on your phone a lot or anything? Yeah, okay. That could be one of the problems. Okay, I'm going to check your ears, if that's okay. Okay. This is a little bit invasive, so just no wax in that ear, that's very clean. Tiny bit in that ear, but I can't see that would cause any pain.
Okay, so
you've not got any earache or anything, or any pain down here. Okay.
So a small amount of wax. So no redness or anything.
No. I'm just going to check behind your ears. No pain at all there. Okay. No swelling I can feel down the neck. Or glands. No issues with the glands. Alright. Okay, I'm just going to take a look in your mouth. Do you mind opening wide for me, please? Okay, perfect. No swelling or anything there, no redness. Tonsils look fine. I will check your oxygen now, if that's okay. Okay, if I put this on your finger.
So this is checking the oxygen. And pulse.
Pulse, okay.
So this number is the oxygen, and that's the pulse. So oxygen
99
is very good.
Pulse is 87.
87, okay.
Okay, that's fine.
Okay, it does fluctuate slightly anyway, so, but that is good. Wonderful.
Especially in this weather, it's been really warm.
Yeah, it's very hot. So we've done the oxygen levels and pulse. You're happy with that. So we're going to have a listen.
Okay. Your chest, all right. Just relax for me. Take some normal breaths.
Take normal breathing.
Okay. And now if you take a deep breath in for me. And out. And again. And out. Perfect. I'm just going to check around the back just because I can hear your lungs a bit better. Again. And out. In. And out. Okay, perfect. Everything seems fine there.
And what I'd suggest with that as well, if we listen to here and here,
okay,
and same with the back, both sides as well. Just you've done this side, so just this one.
Breathe in and out. Breathe in and out.
That's good.
Breathe in and out. Breathe in and out. Okay, good. Okay, everything seems normal. I can't hear any wheezing or anything. Lungs are clear.
Good. And I'm guessing heart sounds fine too.
Yeah. And how are you feeling after the deep breathing? You don't feel like you're out of breath or anything? Okay, that's good.
Wonderful.
Perfect.
The patient feels okay.
Have you ever had your blood pressure done before? Okay. So you know it gets tight around your arm.
Wonderful.
Okay, I'll just pop this on your arm, please. Sorry, wrong one.
There we go. Wonderful. I like you've corrected that. Good correction.
Okay, it's going to go tight around your arm.
You can just relax your arm on your leg for me. There we go.
Breathe if you feel anxious. Uncomfortable, and then it will just release when you feel like you can't take no more.
Okay, let's have a look.
84 over 64.
And pulse is
76.
Right, so what do you think about that reading?
I think from my knowledge it's just a tiny bit low.
Yes, that's correct. So it is a little bit on the low side.
Pulse is fine.
So I would just say, give it another couple of weeks, come back and just do a blood pressure reading.
Just to check.
Yeah.
Okay.
If you do start to feel dizzy, weak, faint, or any weird sensations, please come back.
It can be normal for some people.
Yep. Exactly, thank you for pointing that out, that's great. Okay, so
how are you feeling after that? You don't feel any dizziness or anything? Okay, perfect. Right, so your sinuses and your glands, we have had a quick look, but I'll just do a more thorough check now, okay?
Yeah, and bring it maybe down here a little bit as well.
And if you just tell me if you feel any sort of pain, alright? Just checking down your neck, over your shoulders. You might feel a bit of tension here. Across your chest. Just going to check it down your spine. Is this where it's hurting you? Okay. Or is it lower back?
Upper.
Any pain?
What I'd probably suggest in a moment is maybe getting her to face that wall or that wall so you can see down the back a little bit more.
Do that now if you want to. Just rotate slightly.
That's it, wonderful.
Just going to move your hair out the way. Just feel down your spine.
So you've got pain around here and up into the neck.
The muscles are a little tight.
Okay.
We just sleep in position and game in position.
Yep, so tight neck and shoulders.
Good posture though.
Yes, I did think so. Good posture. How does the actual neck feel?
Fine.
If we rubbed slightly down the spine, can you feel any ridges, any lumps or anything?
Just the spine.
Okay. What I will do is have a feel over myself in a moment just to double check.
Just checking the base of the head, the neck. Will feel alright. If you want to just check.
Yeah.
Check the neck. It seems okay. No, sorry.
Just let me know if you do feel any pain or discomfort. You can feel knots here.
Mm-hmm.
Okay, if you could just hold her hair out of the way. Okay. Do you get pain here? It feels really, really tight here. Occipital. You could probably do with having some kind of scalp massage, but focusing here and down on your neck. The bit of the spine here is a bit swollen. And there feels quite tight as well. Okay, that's fine. So, I'd recommend some kind of massage, maybe a sports massage on the neck, occipital, upper spine and shoulders, and see how we get on with that. You may need to come and have a scan on the upper section just to see if there's anything going on. There's definitely a lot of tension and build up there, which is definitely going to be contributing to headaches. I would suggest maybe starting some ibuprofen gel or something like that, maybe a bit of deep heat and rubbing it into that area, or possibly a CBD salve or something like that. That's really going to help. I can send over some recommendations for you. And do some exercises in your head and some arm stretches. So basically you want to be going out up and behind, shoulder rotations either way, and neck rotations like so, morning and night. If you can do that for a week, and then you can come back and see how we get on.
While we have got you here, do you want to try and do a shoulder rotation just to see if it aches or anything?
Yeah, you can do
so
that.
Just roll your shoulders for me, and the other way. Any aches? It cracked a little bit, didn't it? Do it again that way. Go on.
Backwards.
Yeah, I can hear that crack somewhere along the arm. Do you feel that when it cracks? Yeah.
Okay, now if you can pop your hands up.
Right the way up. Okay, good. Well, that's good. That's level.
And this one.
Again, it's level. It does crack a little bit.
Okay, and put them out to the side.
Okay, that's good.
And what about behind?
Good. Okay.
Did you find that crack sometimes when you do that? Okay. There's definitely a lot of tension there. There's something not quite right with that section. I think what I'm going to do actually, my lovely, is I think we need to just get her sent for an MRI. I think, just to be sure on that. Okay.
Yeah, and just do some stretching exercises for your back. It will help.
Yeah,
Loosen.
definitely do what I've suggested. But great job on listening to the cracks and the noises. That's something
Thank
that I should have mentioned. So well done on that one.
Thank you.
Okay. Now, do we feel like that is everything? Would you like to have any other recommendations or any other checks? You're happy with everything?
Yeah, I'm quite happy with everything we've done. Yeah, I think it was quite thorough.
Okay, so yeah, I'm happy with that.
Okay.
So my recommendations, which I'm sure you'll agree on, is go to the optician, have your eyes tested, get maybe a sports massage or a deep tissue massage, get an ibuprofen gel, deep heat, or maybe CBD slough, as I said, and continue to do the exercises day, morning and night. Okay, I'm happy with that. Wonderful. Are you happy? Okay, great. So as far as that goes, that's fantastic. I'd definitely pass you on that.
Thank you.
Just remember to take things a little bit slower. So
Okay.
when we listen to our chest, we listen both sides
Yeah.
and on the back. And take your time to have a listen to the lungs and the heart, and then obviously you can move on. Normal breathing and then deep breathing.
Okay.
But other than that, I'm quite happy. You've recognised that the blood pressure is slightly low, and that the pulse and the temperature is fine and the oxygen levels are good. So I'm happy that you're okay. Get your MRI scan done, you know, and then we'll see what's going on, and then we could maybe treat migraines with something. But we'll get you back in, if you like, in 4 weeks. Is that okay with you? And I'll probably get her to get some bloods. I think that might be good. If a patient is complaining of, say, excessive migraines and we haven't done bloods, then I think we need to get her in for that. So I will arrange that for you and get you a blood test form.
Especially because of feeling around, there was no specific signs of what could be causing it.
Exactly. I mean, we could have a deficiency
Yeah.
of something, or, you know, we might get inflammation showing up in the body. We might
With
not.
the low blood pressure now and again. If it's low often.
Exactly.
It could be causing it, yeah.
Yeah, it's maybe because then you're not going to have enough blood going to the muscles and areas like that. So, okay, I'm happy with that. Are you?
Yeah.
Wonderful.
Thank you.
So let me just say that there. Right, thank you so much for coming in. All right, I hope everything has been clear, and thank you so much for doing a fantastic job.
Thank you. Thank you.
You're very
so
welcome.
much.
Okay.
Take care. Nice
Bye-bye.
to meet you.